Hi, this is Dr. Tranchitella for Sunrise Functional Medicine. And in the face of COVID-19, I mean, here we all sit, it's late April, and we still have a lot of restrictions and a lot of limitations as to what we can do. And in studying this disease and looking at some of the pre-existing conditions that will make the experience of COVID-19 particularly bad for some people, there's been some certain conditions that can make it really bad. And a few of those are type 2 diabetes, metabolic syndrome, cardiovascular disease, hypertension, and COPD and other chronic lung conditions. And when I think about some of these pre-existing conditions, I think it's concerning because, especially with something like metabolic syndrome, which is basically a cluster of conditions that can predispose to type 2 diabetes and further down cardiovascular disease. And this condition, metabolic syndrome, is largely preventable through dietary and lifestyle measures. And it's not to say that that is the case for everybody. Some of us come into the world with a natural predisposition to have some glucose dysregulation or insulin issues. But a lot of the factors that we include in our lives can contribute to a worsening of that condition. So when you think of metabolic syndrome, the cluster of conditions basically includes hypertension, visceral obesity, which is truncal obesity, belly fat, hypertension, which I already mentioned, elevated fasting insulin and elevated fasting glucose. You may have dyslipidemia, which is an imbalance in your blood fats, so elevated total cholesterol, triglycerides. And all of these things can contribute to this syndrome that creates a fundamental imbalance at a basic physiologic level. And so further down the line, you could have some hormone imbalances. There may be sleep issues associated with it. Certainly the weight gain is not good. It's basically a pro-inflammatory condition, which is one of the things that makes it so challenging with something like coronavirus. People who have these metabolic disorders have a dysregulated inflammatory reaction. So when they encounter a virus or anything that ramps up their immune system, that reaction can be too much. It flares up too much, which is part of what we're hearing about with a cytokine storm and COVID-19 is these people who are already compromised mount this dysregulated inflammatory reaction, and it can push them into a cytokine storm where it becomes this uncontrolled inflammatory process. And so the precursors for this, type 2 diabetes, metabolic syndrome, cardiovascular disease, and hypertension are conditions that are very common in our culture. And so it's very concerning that so many people out there are predisposed to have a bad reaction to a serious virus. But I think it's important to consider that with these conditions, there are a lot of things that we can do to correct those problems. But you first have to know that you have them. I think it's very easy for us to, do an assessment of the foods that we eat. Do we get enough exercise? Are we overweight? Are we putting on a lot of belly fat? We can kind of see those things in our lives, but unless you do some testing, you're not going to know if you've got some of those key metabolic markers that are really pushing you towards a more serious chronic illness. So, it's very important to just consider these things because they don't just exist in and of themselves. When you are challenged physiologically with a serious virus and you have these underlying conditions, it can really go badly for you. So if you are experiencing that right now, please reach out and take the time to get yourself well. It can make you feel better on so many different levels. So it's something that can be easily addressed through diet and lifestyle measures, and you can really turn it around through some basic naturopathic therapies. Thank you.